Today we will be discussing about the first topic of pathology, that is cell injury adaptation. Cell injury adaptation. So what is the cell organelles that is affected during cell injury? The cell organelles which are affected during cell injury is mitochondria, endoplasmic reticulum, nucleus, and plasma membrane. So these are the cell organelles which are affected during cell injury. What is the cause of cell injury? The first cause is hypoxia, that is decreased oxygen supply to a tissue. This is the most common cause of cell injury. Most common cause of cell injury. And what is the most common cause of hypoxia? Most common cause of hypoxia. The most common cause of hypoxia is ischemia. What do you mean by ischemia? It is referring to the decreased blood supply. So if there will be a decreased blood supply to a tissue, then there will be a decreased supply of oxygen and nutrients both. So ischemia is the more severe form of cell injury than hypoxia, as when blood supply decreases, supply of all nutrients including O2 is diminished. Now let's see the cells which is more sensitive to hypoxia. The cells which is more sensitive to hypoxia is neurons. These are the first one which will react when there is a lack of oxygen in our body. As you know, when there is a lack of oxygen, then our brain react very fast. And what is the cell which is least sensitive to hypoxia? It is fibroblast and skeletal muscle. Other than hypoxia and ischemia, there is also other causes of cell injury, like there are physical agents such as radiation, chemical agents such as carcinogens, infectious agent such as bacteria, viruses, and genetic abnormalities such as mutation. And there are also some immunologic agent which can cause cell injury. And there is also like nutritional imbalances which can also cause the cell injuries, like deficiency of protein energy malnutrition, PEM, or obesity can also be the reason of cell injury. Now let's talk about the manifestations of cell injury. That after cell injury, what will happen to the cell? First of all, the cell will try to adapt, that is adaptation. And in adaptation, there are certain type of things like hypertrophy. Some cells will get hypertrophy, some of the cells will get hyperplasia, some cells will undergo metaplasia, and some of them will go atrophy. So first let's discuss about adaptation. In the case of hypertrophy, what is hypertrophy? Definition: it is the increase in cell size but no increase in number. Means the cell size will increase but not the number in case of hypertrophy. What is the mechanism? It occurs due to the increased synthesis of cellular proteins like GATA4, GATA4. What is the full form of GATA4? It is GATA binding protein 4. NFAT. The full form is nuclear factor of activated T cells. And MEF2, myocyte enhancer factor 2. These three proteins leads to the hypertrophy of cells. What is hypertrophy? It's increase in the cell size but no increase in the number of cells. And hypertrophy, it occurs mostly in permanent or non-dividing cells. means hypertrophy mostly occurs in permanent or non-dividing cells. Now I'll tell you the examples of non-dividing cells. But hypertrophy can also occur in dividing cells, but mostly in non-dividing cells. Now let's differentiate the type of cells based on their division ability. Like we have different type, like permanent or non-dividing cells. I hope everybody knows this. Example, they are cardiac muscle. These are permanent, right? They don't divide. Cardiac muscles, skeletal muscles, right? And there is other one which is stable cells. Like it's like neutral in the case of liver or pancreas. And there are labile cells which like divide very rapidly. What are the examples? Bone marrow. It divides very rapidly. Skin epidermis. So these are the things I've differentiated, like type of cells based on the division ability. So hypertrophy, it mostly occur in the permanent or non-dividing cells. Means what? Cardiac muscles, skeletal muscles. Now let's talk about the type of hypertrophy. There are two types. One is physiological hypertrophy, and other one is pathological hypertrophy. Now let's take the example of physiological hypertrophy. Uterus during pregnancy. Second, breast during lactation. And the other one, skeletal muscles in bodybuilders. You know, when we go to gym, the hypertrophy of skeletal muscles happen. The increase in the cell size. Now, pathological hypertrophy, example, left ventricular hypertrophy. Due to hypertension. This occurs due to hypertension. And other example of pathological hypertrophy is in the case of stone in bladder, in the urinary bladder. Suppose there is a stone here in the urinary bladder, right? So the part proximal from the stone of the bladder, this part will get what? Hypertrophed. So these are the example of physiological hypertrophy and pathological hypertrophy. So in this topic, we have discussed about cell adaptation, hypertrophy part. So in the next video, I'm just going to explain you about the hyperplasia part. Thank you so much for watching the video.